So we are going to do chapter 13 notes part 1, which is introductory to the respiratory system and respiratory anatomy. All right, so what is the overall function of the respiratory system? Well, why do we need to get oxygen in the body, and why do we need to get carbon dioxide out of the body? Well, we need oxygen. Why? That's what I always want you to think about, is why do we need something? We need oxygen because our cells need it to do um, aerobic respiration in the mitochondria of the cells to make ATP in copious amounts. Okay. We need to get rid of CO2 because CO2 accumulates in our body. It travels around in its acidic form, which will, if it accumulates and we don't get it back out into the environment, it's going to build that acid level in our body and then cause us to become acidotic. Additionally, the acidity in our blood actually decreases hemoglobin's affinity for oxygen. If we can kind of do a float back to chapter 2, where we talked about three-dimensional proteins, hemoglobin is a three-dimensional protein or globular protein that we have in our blood that's responsible for carrying oxygen. And when pH and heat are altered, it actually affects its affinity to hang on to oxygen. So why do we need to breathe? Well, we need to get oxygen in so that we can make ATP in an appropriate way, but we also need to get CO2 out so that it doesn't negatively impact our body to the point of, potentially killing us. The primary reason that we breathe, believe it or not, is to get rid of CO2. Oxygen does not become the primary reason or motivation for us to breathe physiologically until it becomes very, very low. So the respiratory system has to work in conjunction with the cardiovascular system to transport those respiratory gases around the body. So the lungs are the exchange point between us and the environment. And by the environment, I mean, the atmospheric air. And then the cardiovascular system is responsible for pushing those respiratory gases around the body. And the blood is just the vehicle that's going to be carrying it. So when it comes to the major structures of, get a pointer here. When it comes to the major structures of the respiratory system, we've got the nose, which is actually the preferred way to breathe, believe it or not. So mouth breathing is not just socially taboo. It is actually less beneficial. When we breathe through our nose, there's actually a couple things that happen to air that are great. It is warmed, it is cleaned, and it is everybody's favorite word, moistened in the nasal passageways. And that actually increases the speed with which it can get dissolved into our bloodstream. So we've got the nose, we've got the pharynx, which is a continuous passageway that's going to have three subsections to it. It's one continuous tube, but we call one portion the nasopharynx, one portion the oral pharynx, and one portion the laryngopharynx. We've got the trachea, which is right here, and you can feel your trachea. Your trachea is going to be reinforced with cartilage. All right, so that's your throat. So you've got your trachea that sits anterior and your esophagus that sits posterior. Your esophagus is going down to your stomach. Your trachea is going from your pharynx down into your lungs. Then we have the bronchi. So so the trachea would be like the trunk of the tree, and then it dissects down here into what we call the primary bronchi. The primary bronchi are going to go into the lungs, and the location with which the primary bronchi go into the lungs is called the hilum. We've heard that word before. And then the primary bronchi are going to start dividing, kind of like an upside down tree, into secondary bronchi, tertiary bronchi, and then very, very small bronchi that are called bronchioles. And then we're going to get down into the one cell layer thick alveoli here. And that is actually going to be the site of gas exchange. Sorry, I've got an itchy nose. So here looking at trachea, primary bronchi, secondary bronchi, tertiary bronchi, getting down into the bronchiole. I know that's hard to see. And then these would be the alveoli. So those are the grape-like clusters or air sacs that are going to be responsible for facilitating gas exchange. So this alveolus, that would be the singular, will have capillaries that are kind of cobwebbing around it. And so capillaries are one cell layer thick, the alveoli are one cell layer thick, and that is where gas exchange is going to happen. That is where oxygen is going to come from the atmosphere into us, and then carbon dioxide that is in us is going to move back out into the atmosphere. And that's where that site is going to happen, is at the alveoli. So when it comes to our respiratory passageways, we have two different passageways or zones, if you will. We have a conducting zone and we have a respiratory zone or passageway. Basically, everything from the nose down to the bronchioles is considered a conducting passageway because no respiration is happening there. And what do I mean by respiration? I mean gas exchange. The alveoli are really the only site of actual gas exchange. So we call everything else a conducting passageway or a conducting zone because air is just moving either in or out. It's not crossing into our body or out of our body. Okay. At the alveoli, that's where we have gas exchange occurring. Okay, so let's start with our anatomy. So our nose, okay? So your nose, all right, we've got two nostrils. We can also call them our nares, are responsible for collecting air. Once air gets into our nose, I don't know if you remember the nasal concha that we talked about. We had a superior, middle, and inferior nasal concha that were kind of coming through our nose like this. It creates this kind of, you know, not webbing, but kind of step-like structure in our nose. What they do is it actually causes air to kind of whoosh around inside of our nose. It increases nasal turbulence. And so air is going to be hitting against the mucosa of our nose. The mucosa of our nose has got hair that we can see, cilia that we can't see, mucus, and our nasal cavity actually has a very rich supply of superficial venous vessels, okay, that are going to actually help warm the air, clean the air, and moisten the air as it comes in. Warming it and humidifying it or moistening it, I know people hate that word, actually is going to increase the rate in which that we can get air inside of us. So we're like one big solution of water, right? Okay, that's the major component of our body. So when we warm stuff and we humidify it as it comes in, it's just going to increase the process with which us, when we get to the alveoli, that we can get that oxygen inside of us. Some other anatomy, all right, so you've got your nose, your nares, the nasal cavity would be inside your nose here. The septum is what is going to be separating your left and right nasal passages. And then you've got olfactory receptors there in your nose, which are helping you with your sense of smell. Respiratory mucosa. So I just talked about this. Okay. So your respiratory mucosa, so it's a mucosa because our respiratory system is exposed to the outside. We've got a lot of superficial veins that have very, very thin walls in a respiratory mucosa that are there to help warm air as it passes by. However, it's kind of easy to get a nosebleed because of those superficial blood vessels. There is sticky mucus that's produced by goblet cells. Goblet cells are intermixed with mucosal cells, and that mucus is there to trap any yucky stuff. We have lysozyme, which is an antimicrobial agent that's going to help get rid of bacteria. And then we've got cilia. So we've talked about the hair that you see in your nose is not cilia. Cilia are microscopic, and they're folds in the plasma membrane. On the apical surface or the free surface of the cells, they are folds, okay? And what they're doing, cilia, is they are, pushing that mucus that could stick nasty stuff to the back of our throat. In the trachea, they're going up, trying to get stuff back up to our throat so we can either, cough it up, blow it out, or, swallow it down to our stomach and have our hydrochloric acid deal with it. And we mentioned this in class. You might become acutely aware of your cilia not working on a cold day when clear mucus just kind of comes out of your nose and you're not even sick. It's because the cilia are just kind of cold and they're not working. Okay, so the mucosa of then the respiratory passageway is made out of that super fun We talked about different types of tissue in chapter 3. Here we go. 3. We talked about epithelial tissue, connective tissue, muscle tissue, and nervous tissue. So this was that fun ciliated pseudostratified columnar epithelial cells. So they kind of look like columns and they kind of look like they're striated, meaning more than one layer, but not really. And so we can see the nuclei of the cells are kind of all over the place. Here's the cilia. So they're made out of ciliated pseudostratified columnar epithelial cells. So this would be the mucosa. This would be the submucosa, so underneath, and this is connective tissue. And if we remember ciliated pseudostratified columnar epithelial cells, epithelial tissue is avascular. So if we remember, we always have to be partnered up with connective tissue. So here's another picture of the ciliated pseudostratified columnar epithelial cells. This is the cilia up here. This is the lumen or the opening. This would be the apical or free surface. This would be the basement membrane sitting on top of connective tissue. This is looking at, this would be the nasal concha as we talked about. So these bones in here that are going to be creating those pathways for air to kind of, I don't know why my nose is so itchy, sorry. Creating different pathways for air to travel so that it comes into contact with that respiratory mucosa so that it can be warmed, humidified, and cleaned. Okay. This is showing that ciliated pseudostratified columnar epithelial cells in the mucosa. These are goblet cells that I mentioned earlier that are producing mucus. And then this is connective tissue that this ciliated pseudostratified epithelium is sitting on top of. So the nasal concha, as I just mentioned, if I go back for a second, here are the concha, these bones here in white. So we've got a superior, middle, and inferior nasal concha. You have the palate. You might have heard of your palate before. So your palate is the roof of your mouth, and it's separating your nasal cavity from your oral cavity. The anterior portion of your palate is going to be reinforced by bone, and then the posterior portion of your palate is going to be soft connective tissue. And then you might have heard of sinuses. Well, people have talked about sinuses and sinus infections. We learned about this back in chapter 5 in the skeletal system. We've got holes in our skull. We talked about your skull was like solid bone. Your necks would be huge, trying to keep that heavy thing up there. But you do have holes, paranasal sinuses that are on the sides of your nasal cavity. And we have sinuses there to lighten our skull, to resonate speech, to help us communicate. So here is our nose. Here are our inferior, middle, and superior nasal concha, but they have mucosa on top of them. And this is showing some of our sinuses. And you may have had like a sinus infection where you're going to feel some pressure here and here because those sinuses are going to get filled with mucus and they're supposed to be empty. And so now you've got stuff in there. So pressure is going to increase. And if you think about it, if you're also pressing on those sinuses, it can affect the way you talk. Um, Briefly going to talk about the mouth because this is more chapter 14 stuff. As I said, mouth breathing is not preferred. Nose breathing is preferred. The oral mucosa does not have the specializations that the respiratory mucosa has to warm, humidify, and clean the air. So the nasal mucosa is made out of ciliated pseudostratified columnar cells, lots of goblet cells. The mouth is made out of stratified squamous epithelial cells. So actually the same thing as your epidermis. Why do we have these like half a penny type cells here? Think about how often you've got abrasive stuff going on in your mouth. So you need to be able to replace those cells pretty quickly. So here is our oral mucosa. So this would be our stratified squamous epithelial cells. This would be, so this is the mucosa, this is the submucosa, and this is actually showing some salivary glands that would be producing saliva in the mouth. In this image, we're looking at our sinuses. So these would be our sinus cavities, our paranasal sinuses, para meaning next to nasal sinuses. And again, they can fill with mucus when we are sick. They can get plugged up, and that's what can cause those sinus headaches and sinus infections. Okay, so from the nose, we're going to go on to the pharynx. The pharynx is a continuous tube going from the back of the nasal cavity to the back of the throat down to just above the larynx. And so we've got nasopharynx, oropharynx, laryngopharynx, not three separate tubes, but just one continuous path. So here's the nasal cavity, here's the oral cavity. This would be the nasopharynx, this would be the oropharynx, this would be the laryngopharynx. Okay. So the laryngeal pharynx and the larynx would be right here. The larynx is where you're going to have your epiglottis, and this is where a big junction is. This is where stuff is going to be rooted into the appropriate place. So earlier I told you you've got your trachea anterior, so that's your windpipe, but we're not going to say windpipe, we're going to say trachea. You've got your trachea, and then you've got your esophagus behind it. And so when you're swallowing food, you've got this common passageway of the pharynx. We need to make sure food and fluid go down the esophagus and air is going down the trachea. And that's where that's happening in the larynx. Another thing that's actually draining into the nasopharynx is our pharyngeotympanic tubes that are coming from our ears. When we looked at the middle and inner ear infections, and do you remember we did the rubric and we were saying, is the person sick? Do they have respiratory symptoms? Why? Because those pharyngeotympanic tubes are actually draining down the nasopharynx, which could cause a runny nose, sore throat, cough, and other symptoms. So the ears are actually connected to the pharynx. Okay. Another thing we learned about in chapter 12 was that we have three sets of tonsils in the pharynx as well. We have the pharyngeal tonsils, sometimes they're called the adenoids, that are in the nasopharynx, the palatine tonsils, which if you open your mouth, I'm not going to do that on camera, but they would be on either side of the back of your mouth, behind your tongue. And then the lingual tonsils are on the base of your tongue. And so those are three sets of lymphatic tissue that are housing immune cells to help you deal with any bad guys that are trying to get in. You probably only really think about them when you have a sore throat and they're swollen. So the larynx, as I just mentioned, it's kind of a, let me go back for a second. So the larynx would be right here. This is where some like traffic control has to happen. It's considered your voice box. The opening to your trachea is actually where your vocal cords are going to be. So your larynx is kind of the space just above your trachea, and it's reinforced with cartilage to keep it open, or patent, patent. That's the word for open. So it's reinforced. Okay. If you think about it, we're a big wet membrane, right? And so if our respiratory passageways were not reinforced with cartilage, water is the most abundant thing inside of us. What do we know about water molecules? Do they like to stay separated, or do they like to hold hands and be together? Well, they like to hold hands and be together. Okay. So if you had a membrane that was not reinforced with bone or cartilage or anything like that, the water molecules would want to adhere to each other. And so the respiratory mucosa would always want to stick to itself like this. So it has to be reinforced by cartilage in order to keep it open or patent. So the larynx is reinforced with cartilage to keep it open. It's commonly called our voice box, and this is where food and fluid are sent down the esophagus, hopefully. If not, then you're choking. And then air is going to be sent down the trachea. Okay. The opening to the trachea can be seen here in the larynx, and that's called the glottis. You have a structure called the epiglottis. Okay. That actually is a flap. So I'm going to turn kind of sideways here. So if this is my trachea, the opening to it here would be the glottis. The epiglottis sits on top of it like this because epi means on top of. And as I'm talking here, my epiglottis is going to be open. But if I, take a drink, if I take a drink of my coffee, what's going to happen is that epiglottis is going to close and cover the glottis, or the opening to the trachea, to allow that coffee to go down my esophagus. Now, you can't talk in and, be chewing or eating or trying to swallow at the same time, because in order to talk, the epiglottis needs to be open so that air can rush out of that trachea and pass through your vocal folds in order for you to produce sound. So, when do we see people choking? Most likely when they're sitting, and talking, trying to be eating or drinking at the same time. So chew, swallow, take a breath, then talk. Don't be doing things at the same time. So this is looking down into the larynx, okay? So this is our epiglottis that would be covering down into our glottis. This is the opening of the trachea, and these are your vocal cords or your vocal folds, okay? And they are going to be vibrating, and they vibrate so fast that we can't see them. In class, we'll probably look at some different images where it slows them down so you can see them whooshing. It's pretty cool. And your trachea like opens and stretches and does all this stuff to make different pitches. So this would be, your throat area right here. That's going to be reinforced by cartilage. Okay. You see your epiglottis that sticks up like this. So it's anterior and then it goes down. So this is open, closed, open, closed. And then going down to your trachea, just like your larynx, we want it to be reinforced by cartilage so that it can stay open or patent, okay? Something interesting though about the trachea is that the cartilage is a C shape, but it's a C shape where the back of the C is facing forward. So I've told you a couple times that there is another tube that is posterior to the trachea, and that's going to be the esophagus. And that's the reason why we have C-shaped and not O-shaped cartilage, is so that the esophagus can press against the trachea and do peristalsis. So the trachea also lined with ciliated pseudostratified columnar epithelial cells that cilia are going to be pushing that mucus that's going to trap nasty stuff and get back up to our larynx so we can spit it out, cough it up, or get it down to our stomach where our hydrochloric acid in our stomach can deal with it. I have smoking highlighted here. So smoking actually damages those cilia and causes paralysis in them. And so if people do not have the cilia working to trap that mucus is going to just slide down the throat, down the trachea, and it's going to initiate a cough reflex to help get that stuff out because we're constantly trapping stuff in our respiratory passageways. When people quit smoking, those cilia can actually start working again. However, for some reason, there's some coughing that could begin. And so sometimes when people quit smoking, they get frustrated because they're coughing more after they quit smoking. But it's actually the body, working to heal itself. Okay, so this is a cross section of the trachea. So this would be the lumen or the inside here. So this would be the mucosa of ciliated pseudostratified columnar epithelial cells. Submucosa, right? That is the connective tissue underneath the epithelium. We're then seeing the cartilaginous layer. So that would be the cartilage. It's called C-shaped cartilage. And then we've got the adventitia, which is the outside, which is connective tissue. And this is just showing another picture over here. So we've got ciliated pseudostratified columnar epithelial cells, submucosa here, which is connective tissue, and then this is showing some cartilage right here. It's just really cool to be able to look at different types of tissue and understand, what they are. I think it's cool. So here is the larynx, here is the trachea. The trachea is going to bifurcate and split at this section. I don't know if it's carina or carina, to be honest with you. I always say carina because I just like the way that sounds better, but I'll have to look that one up. But when stuff actually hits this area, that's what can initiate the cough reflex. And so people, like I said, with smokers, they're going to have mucus draining down. It's going to hit this area where the trachea separates and the cough reflex is going to be initiated. The trachea is then going to split into the right and left primary bronchi. The right primary bronchi is shorter than the left primary bronchi. And my understanding from some reading I've done is that if something's going to get choking's going to happen, it's going to get lodged in the right bronchus. So the bronchi are like if you think about a tree upside down, so you've got the trachea and then the bronchi are going to split off will be the two main branches. They are then going to be part of the conducting zone to bring air to the secondary bronchi, tertiary bronchi. Finally, they're going to get into really, really teeny tiny bronchi called bronchioles. So trachea, primary bronchi, secondary bronchi, tertiary bronchi, bronchioles. And the bronchioles are going to feed into the alveoli. So this is the alveoli enlarged, one cell layer thick. The alveoli are responsible for gas exchange. Let's talk about the lungs. So the lungs are actually pretty large. They're made out of this soft pink kind of spongy tissue, and they are surrounded with a serous membrane, which we've learned about before. Serous membranes are a two for one special, right? You've got an inner visceral and an outer parietal, and they have to be adhered to each other. And it's actually the serous membranes that keep our lungs inflated, the connection between the two, the adhesion between that little bit of serous fluid that's produced. So we need to have that adhesive properties of the water molecules, keeping our lungs inflated. If something gets in between the serous membranes, okay, it can cause lung collapse to occur. So we've got a left lung and a right lung. The left lung is going to have two lobes because you have the heart that's etched out on the left side and the cardiac notch of your left lung. And the right lung is going to have three lobes. They have an apex or a pointing part on the top and then a base at the bottom. So it's the opposite of the heart anatomy that we learned. So this would be the apex, this would be the base. This is showing, the inner lung. This would be the parietal pleura on the outside. There's a little bit of fluid that actually keeps the visceral and the parietal pleura. So they are the serous membrane and attached to each other. And then here's the diaphragm. The diaphragm is actually going to be involved with helping us increase or decrease the volume of our chest cavity in order to bring air in or push it out. And then finally, the alveoli. So this is the only portion of our respiratory zone. Why is it considered the respiratory zone or passageway? Because this is where gas exchange is happening. One cell layer thick of two different types of cells. We're either going to have squamous epithelial cells, so those are little tiny flat sacs that are responsible for gas exchange, or we're going to have some cuboidal cells that produce a substance called surfactant. What surfactant does is that it decreases the water tension so that water molecules are not trying to adhere to each other. So you have these alveoli that we want to look like those big puffy green grapes. But again, we have a lot of water in us. And so naturally, these alveoli want to kind of clump up and look like little raisins. We don't want that to happen. We want our alveoli to stay open and patent. And what surfactant does is that it overcomes the water tension so that the alveoli don't collapse and it keeps them open. You might have heard of babies being born before their lungs are mature, and what they mean is, are they producing surfactant or not? So like my daughter was born before surfactant was being produced, and so she had to be given a synthetic surfactant. I know she had to have some respiratory assistance for the first couple of days of her life because her alveoli couldn't stay open or patent because of that lack of surfactant. Um, so alveoli, they are going to create anywhere from 50 to 70 square meters of surface area for gas exchange to happen. And what do I mean by gas exchange? Oxygen is coming from the atmosphere into us, and CO2 that's in a really high quantity inside of us is going to go back out into the atmosphere. And that's going to happen across the respiratory membrane, which is in the alveoli. So here would be the bronchiole going into the alveoli. So they look like clusters of grapes. And again, they need to look like big, juicy green grapes. We want them open and patent. When people have things like different chronic obstructive pulmonary disorders or that lack of surfactant, what happens is that the alveoli collapse. And when people breathe, not only do they have to get air in, they have to get air in with enough force to pop open those alveoli. And that's very, very exhausting to do, to be able to have to breathe, as much as we have to breathe at, 12 to 20 breaths per minute to keep us alive and healthy. Having to breathe with that much force can be very tiresome, especially for like a little baby or an older person. So this is showing the nasal cavity down to the pharynx. So you've got nasal pharynx, oral pharynx, laryngeal pharynx, larynx, which is where stuff is going to get rooted to the right place, trachea, primary bronchi, secondary bronchi, tertiary bronchi. This would be a bronchiole, and then going across a cross section here to the alveoli. And what this is showing is that the alveoli are one cell layer thick. There are capillaries that kind of spider web around the alveoli, and we have carbon dioxide that's going to get pushed into the alveoli that we can exhale out, and oxygen is going to get pushed in to be ferried by our red blood cells and our hemoglobin that we're going to carry on to the rest of the body. And again, this is showing, so ventilation is the actual movement of air in and out of us. It's actually the first phase of respiration. It's called pulmonary ventilation. And so what this is showing is that oxygen is going to be diffusing into our blood, and carbon dioxide is going to be diffusing from our blood into the alveoli to be exocytosed. And as we remember, you have the pulmonary artery that's going to be coming from the